It's just so categorically incorrect. The fact that we evolved to do this, and humans, specifically female humans, evolved to have a post-reproductive lifespan of a few decades long, and we're adapted to it. None of that means that we don't take estrogen. It's not like an either or, but it's just the narrative around it is wrong.
I'm Annemarie McQueen, journalist and proud 50-ish woman, and we are here looking for the true truth in perimenopause, menopause, midlife, and beyond.
Opening our minds to other possibilities is not always easy.
Hot flash ink.
You're all woman to me. All right, Annemarie.
Has your doctor told you that you're too young for perimenopause? You just don't feel like yourself? You are not alone. Perimenopause can start earlier than you think. That's why MenoLabs is here to support you with a range of products and the information you need to confidently speak up and get the care you deserve. They also offer science-backed products like their bestseller, MenoFit, a probiotic designed to help relieve symptoms like hot flashes and night sweats and more, all while supporting your overall health and wellness. Don't settle for less during this season of your life. Visit MenoLabs and get the support you need today. Right now, they're offering our Hot Flash Inc. listeners 20% off using code HOTFLASH20 at MenoLabs.com. Now for the small print, this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Okay, welcome back to the Hot Flash Inc. podcast. I love talking to you. Rather than just talking about a topic, I thought I would just give you 3 things that are on my mind and get your take on them.
Yeah, I'm just bracing. I'm worried about what they're going to be, but yeah, go ahead. Yeah.
Okay. So I have noticed a trend, and really in my journalism career, I thought I was like this smart pattern spotter and trend watcher, but now I realize that I'm probably just spotting really effective PR disseminating through the world. So I'm not as smart as I thought I was. I don't have that skill, but I have seen Dr. Mary Claire Haver send out a newsletter on Substack talking about how, yes, hormone therapy for women who are coming to her who want weight loss. Hormone therapy is very helpful, but what really is the magic ingredient is the addition of a GLP-1 medication. And then I saw a couple of videos on social media about the same thing. A very healthy naturopathic doctor talking about how she was doing okay, but it was really the GLP-1 that helped her. And so I wonder, this seems to be a trend, hormone therapy and GLP-1 as your anti-aging weight loss stack.
It does seem very much around, as you say, marketing like pink washing. So if you pair it with estrogen, then it's targeted, boom, straight at women.
That'll really get you there. But before they said
Yeah, I mean,
hormone therapy that would get you there. What's next?
clearly GLP-1s work for weight loss. Clearly they do. I just wrote a book on metabolic health. The backstory to all this is collectively, many of us in the world, through no fault of people, no fault of our own, or no, it's not people's fault, but we are in an epidemic of some metabolic dysfunction and weight gain, and the environment has done this to us, and it's a tough road out of it. And the fact that these medications work so well everything through my lens is as a biologist, former biologist. It's pretty intriguing that this gut hormone talks to the brain the way it does and dials down hunger and dials up energy expenditure. It's actually pretty fascinating. And I've just been observing the trend through that lens. I have a few patients taking GLP-1s. I'm certainly not against it or anything, but if you just start really, it exposes, or it shines a light on the intricacy of the system, because there's lots of really intriguing ways that the gut talks to the brain. There was just just tiny tangent, but there's new research about how it appears that immune cells from the gut, this is a little separate from GLP-1, but immune cells from the gut travel to the part of the brain that controls metabolic rate and hunger and everything, and communicates to the brain what's going on in the gut. And it stops off. Apparently, these T cells stop off in fat tissue on the way to the brain to do some fact checking and get a bit more information and communicating all this to the brain. So it's a fascinating, intricate system. Yeah, the fact that you can impact the system with those medications is interesting. I suspect it won't be how people are doing things in 10 years, but I know you've asked me other times, what will people be doing in 10 or 15 years? That will be the very interesting, because we've been, both you and I have been around long enough to see various health trends come and go. And every 10 or 15 years, there's the new medication, the new kind of label that's put on things. And yeah, so I don't know. I guess I'll just, in closing, say that I know that severe metabolic dysfunction or severe obesity certainly is very distressing and it requires medical treatment. So or requires attention in some form, sometimes medical treatment. But beyond that, I don't know. Would you have other thoughts on the GLP-1 that you want to kind of share?
I'm as minimal intervention as possible in my own life. I find regular life kind of stressful. I'm pretty sure I have whatever, ADHD, some sort of tism. I don't know what, but to me, the thought of having monthly prescriptions that I have to get and I have to worry about if they're going to be and supply chain issues and
I know
how my body's going to react. I'm a very sensitive person. So in my own life, I'm anti-interventionist, but I just feel like it's not my first rodeo. And I just see people just hopping on so quickly
I know.
without knowing anything and repeating pharmacy or pharmaceutical industry talking points and I see medical doctors doing this too. And so that concerns me when I see pharmaceutical company talking points being put forward as the reason to go on something and then not the abundance of caution that I would think that you would exercise on things, because I think there are some concerns with these GLP-1s in terms of side effects and perhaps longer term effects. The Daily Mail has done some coverage. Anis Mukherjee was quoted in an article about possible connections to tumors and cancer. So we just don't know this yet. And people just seem like they'll just chuck it out. Like, no, it's just, oh, I can lose weight. That's it's complicated to me, Lara.
And also, I've heard you talk about this too on hormone. This is similar with the hormone therapy. It's this, and you're not alone in not wanting to become like totally reliant on the medical system for, yes, this supply of medication, not in case anything really bad happens, but just from the independent freedom perspective. I get it. I think, and of course, some people don't have any choice and they're on medications that I guess they just can't come off. But to willingly go on a lifelong medication, is a big decision.
I've always had a weird thing, or I don't know, I can be very much a risk taker and not give anything too much thought. But in my life, when I was younger, it's like, can I sustain this? Everyone was taking greens when I was 30 and late 20s. And I'm like, but these things are $40 a month. I can't afford it if I take that 1 month. And so just that thought of, I just feel like sometimes it's important to think about, will I be able to do this? Do I want to do this? And so that's for me personally. But so that leads us into a trend I've noticed in my own life where I've always taken a ton of supplements. I remember going home to visit my dad once and unloading my supplements and him just standing in the doorway going, this can't be good for you. And then another trip home, I said, I'm not taking these. And I didn't take them. It was a family vacation in 2019 to the East Coast. I did not sleep. So clearly I needed the magnesium and some of the other supplements. But I'm just realizing that as part, I think, of going through menopause and realizing that I hold a lot of strength and sovereignty within me, that I've been using supplements as some sort of mommy and daddy can help me. And I take these supplements and they're going to do something as some sort of security blanket. And then I noticed my friends speaking about the same thing. Like my best friend said, I'm going to get rid of these supplements. They're so expensive. I don't know what they're doing. And so I just wondered, and I also think some supplements can be doing harm. Like I was very tired and I took maca and I had terrible side effects from it for 2 weeks. I didn't sleep. And this was something I took in my 40s because everyone told me to take it, that it would help with my perimenopause symptoms.
Yeah. One thing I've done with patients for years and with myself sometimes is just have a supplement holiday. Like just ask, especially if they're on a lot of things, like 20 things, I'll be like, okay, let's just have a break. Like they're not the kind of thing that you have any of them that you can't take breaks from. So let's just take a couple weeks, just get down to like blank slate, just see where we're at. And then maybe add some things back. So that's something I would routinely do. And I take fewer supplements now that I'm a naturopath. So obviously I have used a lot of supplements in my time, but I take fewer now. And I'm getting ready to go on a big trip overseas and I am paring down to magnesium. So there you go. I'm like, I need magnesium. And I'm taking a probiotic as well, because we're going in areas where I'm worried about my gut health a little bit. Right. But yeah, so I think there is a place for just paring down Yeah, supplements should not, again, they should not be, it does tie into what we were saying before. This just becoming super reliant on something external to yourself, this external locus of control. You have to have this thing to make you okay. And so yeah, I'm supportive. I think people can, in most cases, just, yeah, it depends. Obviously, if someone's, it's always going to be, what if someone's who's got super heavy periods and they need iron? It's okay. Don't take a break from
Yeah.
your iron if your doctor's prescribed iron. Obviously, there's going to be various situations where that's not advisable, but there's, in most cases, the supplements are, yeah, you can take breaks from them or stop them at some point. And that's different. I just circling back to the GLP-1s for a little bit. I'm not an expert on those medications, but like I said, through my biologist antenna, have been out intrigued by the system that they work on. But one thing I do worry a little bit about is once you intervene with quite a strong hormone medication, and it's not the natural hormone. I'll just point out the GLP-1 medication is not a body identical GLP-1. It's an analog. It's quite different in some ways. It has a longer lifespan. But I do wonder if once that's been in the system for a couple of years and then you remove it, what happens to the system? You know what I mean? Like, how is that system? That'd be the same for any kind of hormone therapy. Is once you've had an exogenous hormone in there for a while and then you remove it, can the system, what happens with that? And the same could be said for taking progesterone and estrogen as well. I think I'm at this point in my understanding and career fairly confident that, for example, you can put progesterone into the system for a while and then remove it, and women are fine. You know, that's one of the reasons I've been more comfortable recommending it, progesterone in particular, because it seems like you can come off. It's a good sign to me if you can come off something when you need to. And again, there's a different, if someone has underactive thyroid and they're not going to want to come off thyroid hormones. Some medication is for life, but the things like GLP-1s and menopausal hormone therapy aren't necessarily for life, or I guess they are. So it depends who you ask. I guess that's
why would you come off them? And whenever I raise this to certain people, they're like, why would you come off them? Because you do get a reverb, or women have reported reverbs of their menopausal symptoms when they go off their hormone therapy.
Definitely you can't come off estrogens quickly. It does need to be tapered down.
Okay.
Progesterone can be just stopped anytime, which is, I guess, now that we're talking about it in these terms, I realize that's one of the reasons I felt more comfortable with progesterone in some ways, because women could just be like, yep, I'm just not going to get my new prescription. I'm just going to take a break.
It's just for your own personal understanding and comfort. That's a marker. No, it's similar to me too. Yeah. Also, the GLP-1s, the full doses, the way that they impact I can never get this word right, peristalsis?
The peristalsis in the gut.
Yeah.
Right.
So the movement of the food, I've read they slow it. I'm not doing anything to mess with my gut in that way, even if it's going to help. To me, after having gut issues for years and IBS, like the last thing, and that's just me. I'm sure someone who's smart about it and has studied it could say, Annemarie, but you're so misguided because it would do this instead. I like to just keep my common sense about it. I'm not comfortable. Yeah.
No, good point. Just coming back, it's a gut hormone. Yeah. From a naturopath perspective, just go back to my, obviously naturopaths have the reputation for everything is about the gut. Everything comes back to the gut. And so the fact that this gut hormone has become so famous, I'm like, it's from the gut. Yeah. And there's research that if you treat the gut I'm not saying treating the gut will, but you can, to some degree, part of the problem with our modern food supply is the way it damages the gut and the downstream. And there's actually research showing that the dysbiosis in the gut damages the cells that make GLP-1. So that's one of the mechanisms by which ultra-processed food is causing so much havoc. You always go back and fix the gut. That's always an option.
You could. It takes more time. Okay. The last one that I have is, I've been seeing multiple videos, doctors, regular people reacting. Your labia is shrinking in perimenopause and menopause. Your labia shrinks. Do we need to worry about this?
I'm just trying to, it hadn't been on my radar at all. So I am. This is one of those videos, or what do they call those videos where they film people's reaction video to watching like a video game or something. I'm like, I guess I'm just trying to understand the concern. So obviously I feel like if women want to be able to still have sex or intercourse, if that's something they want, then obviously this could be part of a bigger part of the genitourinary syndrome, making sure there's good lubrication and good, oh, sorry, my phone just beeped. So I don't know, is it about that? Is it about reduced ability to have sex, or is it like a cosmetic
thing?
It's
being presented as like, did you know this is happening? Like a bad thing. But I think it's one of those things that if you just calm down and think, Yeah, okay. Obviously, my labia are going to change a little bit, regardless. People's breasts change, their
Well,
knees
and to be
change.
fair, anyone who's got a man in their life will know that their stuff changes as well.
Okay, thank
Things
you,
do
Lara.
change.
Thank you. I did quite a bit of dating in my estrogen spike end of my menopause, and I can say things change.
Here's the difference between like how things are presented to men versus women. I'm just thinking this recent comedian I saw joking about, which is funny about how like the scrotum gets really saggy and long and like the testicles like sag down. And but we don't really see men going, did you know
Yeah.
that after 50, like your scrotum is, I just can't even imagine a man would be like, what?
They
Like
just
it's
know
not
it and deal
nothing
with
to
it. They're just knowing it in whatever. It's a joke. It's a comedian's joking about it in a way that's not mean to men, but yeah, it would never be presented
I mean,
like
it's
men.
not, I guess, and again, maybe there's something I'm missing about it because the whole shrinking labia had not really been on my radar. So if there's a health aspect to it, then I mean, for sure, it is true that just for completeness, it is true that the genital urinary syndrome of menopause, where it can contribute to UTIs, like the shrinking and the general kind of atrophy of the tissue can cause UTIs and painful sex and various things. And so that, and dryness, and that definitely. So I'm actually a pretty big fan of vaginal estrogen. I don't know if this is, I don't know, but I don't know, is this like a scare tactic to take vaginal estrogen? I'm just trying to understand. Like this is one of
I'm trying to understand
so
it
many
too.
things where, as we've been doing this a long time over the decades, there are so many ways that the female body is micromanaged. It's, did you know this? So many ways to make us fearful and ashamed and embarrassed of our own bodies. Is, oh, you look like this, or you smell, or you do. Like in so many ways, the female body is, and it has, and of course, this goes way back as reputation of the female body being unruly and difficult.
I remember in my 30s when they started doing the operations to enhance your labia. And then I didn't even know. That was my introduction to the fact that maybe there might be something wrong with your labia.
Labia do come in, people do hopefully know this, but labia come in a wide variety of shapes and sizes. Like it's actually quite, because of course we usually just know our own labia, but
I love
like
talking to men
there
about this.
are
I love talking to men about this. Yeah. Just like
like
men come in all sorts of shapes and sizes.
there's quite a variety, which is actually really fascinating.
Yep.
So how this fits into it, I don't know. I'm personally not gonna, for one, I personally haven't noticed anything along those lines, and but now maybe now I'll be like popping awake at 3 a.m. going, oh, I hadn't thought about my labia.
Your genitourinary syndrome of menopause, those are things to worry about, and vaginal estrogen is a viable option for that. But worry about the size of your labia and in some sort of sense of loss. It's such a magical.
Oh, it's like a sense of loss, or as you say, some women are trimming them down because they're embarrassed of them being too big. I'm just like, what's the perfect size? Then I thought they do come in different sizes.
The perfect size is whatever someone's trying to make you feel it is. But so that's a good argument for just deciding you're the perfect size. Okay, wild card. Do you have anything on your mind that you have?
Yeah, I just the thing that whenever I have an audience, I do talk about how menopause evolved and it's not an accident of living too long. I really can't. There's lots of narratives out there all the time. Whatever decade we're in, there's going to be various narratives around health. Because this is the way health works, actually, and we all spin these stories, and I would do it too because I'm in the health space. We create this story, whether it's like around histamine or around dopamine, and most of them I could just let slide off my water off a duck's back. I'm like, okay, I don't agree with that, but I'm just going to let that go. But the one, if I hear anything about menopause as an accident of living too long, I literally stop in my tracks. And I have to, like, my back goes up. I'm like an angry cat. Like that is just incorrect. It's just so categorically incorrect. The fact that we evolved to do this, and humans, specifically female humans, evolved to have a post-reproductive lifespan of a few decades long, and we're adapted to it. None of that means that we don't take estrogen. It's not like an either or, but it's just the narrative around it is wrong. And speaking of narratives, the other thing, just one more thing I want to say. I've been seeing patients for almost 30 years. And just in the last couple years, I have noticed a sharp, quite like change in the way people speak about their bodies. There would have been always people asking me like 15 years ago, oh, about hypoglycemia or adrenal fatigue, or these are narratives, right? Or whatever, or candida. This is going way back into the, like, whatever the thing was. But now, like, at least I used to, patients would normally like just say, okay, they talk about their sleep or their fatigue or just in real terms. I've had patients lately just telling me things like, and then I'm saying, how are you doing? And they're like, my dopamine's dropping in the morning and then my cortisol's spiking, and everything is through the language of these like neurotransmitters and hormones. And I'm like, okay, I get that your cortisol is spiking, but actually, what does that mean? Is it like anxiety or not sleeping? Or I'm just trying to actually dig down to get a real person experience and not through the filter. And I'm sure this is coming from social media, because then I had a patient who was just talking in normal terms again, and I asked her about it, and she's not on Instagram at all. So there's like, so I got this one data point of a woman who's just not on Instagram, not following any health accounts, and was just able to talk about health in a kind of,
You know what that makes me feel like a little bit? Are you tired? Are you angry? What is actually happening in your body versus what someone's telling you is going on? And it reminds me a little bit of when you go to talk therapy, and I'll sit there when I went to talk therapy and I'd talk about the problems with my family or my boss or my friend.
Yeah.
But you're not getting at the actual real emotions that you're feeling and why you're feeling them. And that's why it's been so effective for me to do like somatic body work and get in touch with what my actual feelings are. And so it's a way of talking at your problems, but never really doing anything about it. It's like an intellectualizing that's not intellectual.
That's a very interesting analogy.
Like you just said, you want to know. I don't care what you think is happening. Really, like I do care, but what's actually happening? Because maybe it isn't dopamine and maybe it isn't cortisol, because you can't really know that. Maybe you're sad about something that happened with your partner. Maybe,
or maybe you're iron deficient. It could be something. Yeah, it could be something emotional. It could just be actually like, sometimes I'm just trying to drill down. Is it fatigue? Is it shortness of breath? Is it
that's what you want to know. How are you actually feeling? Not how are you framing how you're feeling. That's really interesting. Yeah. As older, looking back on what I used to do, I did a lot of that. It wasn't around then when in my 40s, but I feel like I'm getting into knowing my own body much more when I'm like, what am I feeling now? I'm angry about that, but why? And I'm tired today. And I would always try to look for explanations for why I'm tired. Sometimes you're just tired and you need rest as well, right? Like sometimes you're stressed and you need to relax.
And just back to the narrative way that medicine is, this is not new. It's always been like this. Like you go back through the centuries and they would be different syndromes or names given to a set of distress symptoms or fatigue or whatever it is, going to be called something different through the years, but they're labels, right? And so I recently heard a phrase, I learned it from a psychologist friend of mine. She's like, wear it lightly. Like whatever the label, whatever the assessment, the diagnosis that you've taken on, fine. Like maybe it can be informative and it can help, especially if it leads to some strategies for feeling better. That's good. That's empowering, but you want to wear it lightly. It's not now you. Like, so there is this trend, which you may have seen, which is concerning, of like people putting their diagnoses like in their bios, or that's not wearing it lightly, because some of these things could be temporary and some are very serious. I get it. As I tried to talk a little bit about this on social media and got a lot of pushback because people, especially if they're really deeply inside a label, it can feel quite like an attack, I guess, to suggest that. And I'm not suggesting people's symptoms or distress is not real at all. The distress and the symptoms can be very real, but the label can be a little dubious because it's just a label.
Because it becomes, that's what it is, and that will explain everything. And I think that's what you're talking about. It is can be hard to be a human, especially whatever you've had happen to you. So I totally know what you're talking about. And I noticed it years ago, before I could ever put this together, when someone would say, oh, my knee, I've got the meniscus tear. I'm like, oh, whatever. I noticed, oh, my arthritis. It seemed this is the reason, right? This is my thing.
Yeah.
And when I say it is a caveat for everything else. This is very controversial to say, and it doesn't mean I don't sympathize, because I've had lots of things myself. But wear it lightly is so beautiful, because it's yes, and yes, you're experiencing this, but you don't have to make it your entire personality and experience about it. You're not going to grow.
It's not your full
move through it.
It's not your identity.
No, the goal is to move through whatever challenges we have or I think work with them. So I really appreciate that. But yeah, it's very alarming. And you notice you get a lot of comments, and I'll get them where it's just, yes, but I have this. Yeah, but yes, but
Yeah.
I have this special thing. And it's okay. I get it. I get it. We all have something, but you can still take a little bit. Anyway, it's a tricky area.
Yeah, it is tricky. One more thing about perimenopause in closing. I had a comment recently. She could be listening to this. I feel bad because I've commented on this a few times, but it really struck me. She said, like on social media, she's like, look, clearly I'm in perimenopause. I'm 48 or whatever. My periods are becoming farther apart. And she said, but I feel fine. Does that mean something's wrong with me?
Oh, man.
What is
That's
happening?
where we are.
No, this is where we are. Like,
Yeah.
because she's seeing all this narrative around perimenopause is so terrible. It's like this. And in her case, she was fine. And so I do say this in my book, and I just want to reiterate: for some women, sail through.
Yeah.
Like for some women, it's really nothing.
Yeah.
They might, it's subtle differences maybe, but they're not gonna. And so that's allowed. And nothing's wrong with her.
Nothing's wrong with her. Oh, I always love talking to you, Lara. Thank you so much.
Yeah. Thank
Okay.
you.
Have a great trip. She's off to where? You're off to-
Tanzania.
Ooh. Okay, that's exciting. Can't wait to talk to you after that. Thank you.
Hot Flash Inc. was created and is hosted by Annemarie McQueen, produced and edited by Sonia Mack. The information contained in this podcast is intended for informational purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, read all labels, and heed all directions and cautions that accompany the products. Information received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem, i.e. menopause or anything else, or any healthcare questions, please promptly see your healthcare provider. This podcast, including Annemarie McQueen and any producers or editors, disclaim any responsibility from any possible adverse effects from the use of any information contained herein. Opinions of guests on this podcast are their own, and the podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about a guest's qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. This podcast is owned by Hot Flash Inc. Media.